Swadika.
Sawadika. That's hello in Thai. Hi, I'm Trish Jenkins. I am past president of Seroptimist International Moreton North Inc. And also I am region trainer for the South Queensland region. With me in Chiang Mai, northern Thailand, is Dr. Jane Edwards. And I'm very excited to introduce you because Dr. Jane has, I've seen some of the work that she's been doing firsthand, but I wanted her to tell you about some of her projects that are particularly are of interest to Seroptimists. She is connected with Seroptimists here in Thailand, but are of particular interest in the area of medical and in women and girls and their education, because it's particularly hard here for women and girls to access those things in an effective way, and that's what she's making happen. I'm especially interested in connecting her with people who are in the medical field, either nursing or doctors or other type of medical professionals who'd like to connect with her. Dr. Jane works 2 months of the year in Tasmania at her medical practice in order to fund herself here for 10 months of the year, and I just think that's really putting her potential and her money where her mouth is. And I just feel privileged to have access to you at such close quarters. So please tell us about the things that are important to you that would be of interest to our Seroptimist sisters.
So we've got a multitude of different types of programs. Some of them are our medical programs where we do community teaching, first aid, and just general health information and trying to get it out there. We also run things like women's nights where we just answer all the ladies' questions about themselves, most of which is not taught well in the current school system. And so a lot of women have no ideas about how things actually work in their own bodies. We spend time doing first aid type training, and we also outreach into some of the communities which don't have easy access to medical services.
You mean like in the villages?
Yes.
Oh, that's awesome.
And along the borders.
Great, because you bought a Burma, don't you?
Mm-hmm.
There are a lot of disadvantaged young girls up there in that border town. Yeah. Great.
We also run programs for children's homes and trainee programs. One of those is a STEP program for girls who have come from children's homes that are needing to step into adulthood. And part of that is training them up to just learn social skills like budgeting and looking after themselves and looking at transport and how to survive in the world, because many of the times when they grow up in children's homes, everything is being done for them and they don't actually have to think about those things. Whilst we do that, we also like to train them up in career options, areas where they can get prestige and influence back into their communities that they come from.
So the prestige and influence, that is something that we sort of chase in Australia anyway. I mean, but what does it actually mean for a female in Thailand?
There are a few social barriers at the moment for girls. It is always harder to succeed and to get into high position and places. There is still quite a significant lack of females in high leadership positions, although this is slowly changing. Our previous Prime Minister before the military coup was a female. And so things are very slowly changing in the country, but there is still a significant lack of females in high leadership positions.
Right. So Jane, you're actually, through the foundation, you're actually facilitating women and girls' influence and leadership and education, as well as improving the areas of their health, which is also very important.
Yes.
And it hadn't actually occurred to me that it's not just about stopping the trafficking, because then what do you do? And it's not just about giving them an education so they can get a job. You're actually wanting to empower them to be an influence, to facilitate change, and that excites me. And that's why I wanted to bring you on and do a video interview and connect you. I'm going to put the links to connect with Jane, the website for what she's doing, and her and provide the contact details, so that if you've got a club, any club that can be supportive of what Jane's doing and find out a bit more about it can do that. I would be thrilled if people who are in the medical field could do that, and might take a particular interest, or even if you wanted to visit sometime. It's just such a wonderful, wonderful place to come. And so thank you for listening. Our support light has run out of time from my phone. We have to use whatever tools we've got on hand to try and communicate, but we are resourceful, we Soroptimists. So thank you for listening, and enjoy your day. And I do hope you'll be able to get in touch with Jane and maybe see what can be done to make a difference and support something that's actually working, which is just really great. Okay, bye.